conversation about clinical identity, insight, and innovation. So you're very welcome, and you're in the right place. While we're waiting for the next minute for more people to join, please do say hello in the chat box and let us know where you're joining us from today. Thank you. We'll be starting in 60 seconds. So I think we should start. And once again, good morning or good afternoon or good evening, depending on where you're joining us from. Welcome to today's webinar. Kieran Walsh is my name. I'm Clinical Director at BMJ, and I'm your moderator for today's session. The topic for today's webinar is Reflective Practice in the Age of AI, a conversation about clinical identity, insight, and innovation. And we're delighted to be joined by our expert speakers, Niraj Swami and also Dr. Osama Soar. BMJ Future Health is a new community that we've created, which is made up of a series of webinars and podcasts and a live event in November. And this webinar is created in partnership with Learner Plus. We believe that innovation through digital solutions is essential to creating thriving health systems which are financially stable, conducive to a supportive workshop, and also that deliver better patient outcomes and healthier populations. At the end of this presentation, we'll be having a few minutes of Q&A where you can submit your questions for our speakers to answer. Please do add your questions to Q&A and any general comments to the chat box. Just a reminder that this session is being recorded and will be made available to watch again afterwards. So it's my pleasure to now introduce our two speakers, Niraj Swami, CEO at Learner Plus, and also Dr. Osama Soar, Clinical AI Fellow at Health Innovation, Kent, Surrey and Sussex. And they are going to explore how reflective practice can protect and indeed enhance the human side of medicine, and how reflection helps clinicians strengthen identity, turn everyday experiences into actual insights, and meet professional demands with more confidence and less administration. So welcome, Niraj and Dr. Osama. Over to you both.
Thank you, Kieran. Appreciate it. Thank you, Doc, for joining and having this conversation this lovely afternoon, morning, evening, wherever you're dialing in from. I'll go ahead and share my screen. It's going to be a very casual conversation. I want to share a little background on why we're here and really focus on the highlight of somebody in practice, somebody that has been working with a lot of tools like AI and helping with their CPD, their reflective practice, their reflective learning. I'm a technologist. I come from a family of clinicians, surgeons. We have our own hospital. I didn't practice medicine, but I've observed them learn all their life with conversations they have with themselves, with peers. And about a couple of years ago, we noticed what happened when AI took over. There was a group thread with my father, who's an orthopedic surgeon, with some other family members. And I noticed something really funny a few months ago where one of the younguns wrote a nice, fun message in a box to reply to my dad's question. And almost instantly, this orthopedic surgeon replies, "Don't chat GPT me." And it's become the joke of the family. It's become a joke of the moment. But what that reminds you, or what that really shines through as, is these clinicians, practitioners, doctors know when it's technology and we want to know when it's people. And there's connection that they really, really drive with. Healthcare is built on connecting with peers, connecting with your patients, connecting with yourself. And as we look at AI and the world of AI that we're in, what is the real cost of all the speed, efficiency, and automation we have? That's where Learner Plus has been focused on. We've been thinking of ways to really help build that connection, bringing AI in an equipped format versus trying to make it really about you know, just getting something done. Um, these tools are getting smarter. These tools are helping us shrink time, but it's also dichotomy. We shrink this time, but we're stretching our skills. We're starting to learn some new things. We can write better, write longer, write faster, write more intricate, research more intricate elements. And that day and age, in the time when AI has become so prevalent and pervasive in our workflows, and we're all embracing it in a beautiful way, it really does affect, impact, and has an opportunity to transform reflective practice. Now, around the world, reflective practice in a clinician in clinical care shows up in a variety of different ways, whether it's point of care, whether it's research driven, whether it's part of your appraisals or validation, or part of just becoming the professional you want to be. And there's a lot of tools that can help you with that. But we believe, and as I would love to explore with our conversation with Dr. Swar, is how in the world with when AI can think and reason so well now, and at least pretend to do so, how do we make our thought process count? That's really what's the humanhood of practice, the individuality, what makes us clinicians, what clinicians represent is really their approach to care, their thinking, how they assess information, assess and understand everything that they see in the practice, not just with patients, but with peers, with other emerging concepts. We just had a conversation the other day with a doc that's an avid podcast listener. A lot of clinicians listen to a lot of podcasts and learn from podcasts. I mean, there's a beautiful podcast with BMJ, and there's amazing insights shared. This particular doc shared something really interesting. She said, and I listened to this podcast about fitness and diet and the relationship between the two. And a couple of weeks ago, there was a really interesting insight that I thought was, unique. And then a couple of weeks later, she heard another episode on that podcast, and that was a completely different or a contrasting view of some of those things. And so, research being told in different ways is what this individual is consuming. How does a clinician in a day where there's so much information being thrown at them and available to them make sense of it? And that's kind of really a place for reflective practice to take off. In this world of rapid content, tons of AI, tons of connectivity with information, it is actually a superpower. We believe reflective learning, reflective practice isn't just a box you tick. It is really how busy clinicians in whatever stage of their training can make sense of the chaos. So that's really been the genesis and the story of where we've gotten, how we've gotten here. And we've had the opportunity to work with Dr. Sama for the last, I would say, about a year. It feels definitely much longer given how much insight and how amazing this collaboration has been. But I'd love for you to introduce real quick. Then I have a few questions for you, Doc. I'm going to stop sharing my screen so we can see your face.
Hi everyone. Thank you, Niraj, for that. My name is Osama Soar. I'm a GP registrar at East London and also a clinical AI fellow at Health Innovation Network, Kent, Surrey, Sussex. Reflective practice in the age of AI. I think as a GP, there's lots of reflections we do, and and people have been using AI for everything. And if I'm being honest with you, people use it a lot more than they like to admit so, and clinicians wouldn't like to admit it. But unfortunately, pressure, time always pushes us to look for the easiest option. And that's just going to be natural. The more pressure we're under, the easier the option is. And I suppose we're in this process. Just a bit of background of how we worked with Niraj and his team at Learner Plus. And so we're just doing a pilot on AI reflections and GP reflections. And it's crazy because we're lucky because the Royal College of GPs have actually said we can use AI in reflective practice. It just needs to be real patience, right? Which makes sense anyway, because in normal practice, you would always use real patients anyway. And I think they've accepted that people will use AI regardless. But it's just to accept that it will be that you might be scrutinized if this was a true reflection or not a true reflection. That they do say that as well. And I thought it was quite innovative for them to actually admit that and just say you can use it, but use it in a smart way. And so there's 2 points of reflection. Do you just put in messages through ChatGPT and it churns out messages that just sound like everyone else? So everyone's reflection all sounds the same, right? I mean, yes, there are going to be nuances and reflections about because every case is different, right? But we will have a similar portfolio and we have to say how we match that portfolio to the particular case. And then everyone's ChatGPT or whatever AI program you use is more tailored to yourself, really. The more you use it, the more information it has. AI works, right? It's a conversation and it sees how you respond, and the more prompts you give it, the smarter it responds towards you. Then it's a case of, so Niraj, I'm going to come back to your point about is reflection tick box exercise. If you ask my colleagues, a lot of them will say yes. It is, and it's always felt like that. And as a trainee, I can see why it feels like that. I would because it's something that's pressured on you, and you have to reach a certain number. But you have to understand there has to be a way to assess doctors in training, and this is the best way to assess doctors in training. So it's the best way to prove that we've reached our targets, reflective practice generally. And then the question is, how can AI make reflective practice better, more interesting? Whereas you just put in information and people just want the information just to be in a reflective written way, right? I mean, as GP trainees, at the end of every day, we reflect on every patient anyway. That is the true reflective practice that we do, right? You discuss with your supervisor at the end and you reflect what you could have done, what you should have done, what have you learned from that, and how this will change your practice moving forward. So reflection, and our portfolio is just supposed to reflect that on paper so someone else can scrutinize and there's evidence for it. How would AI help in that term? I suppose when we done this pilot, a lot of people were frustrated because they just wanted something like that. They wanted AI just to come up with a solution like that. They wanted the magic, right? They just wanted to put in information and it'll churn them out, something that looks amazing and that comes out. But then it's not unique to them. And then in 10 years' time, our emails back and forth, our conversations, our written work, it's all going to sound the same. There's no uniqueness to it. Even for example, this is reflective practice, but I'll give you an example. There's NHS have spoken about ambient voice technology, so you can have recording your consultations, right? Or going back and AI recording your consultations. I initially was doing that in my practice, and my trainer told me he wants me to stop using it. And I asked him why. And he goes to me, because it's too much information and it's clear you never wrote it, right? And then it's no one can, in a 10 minutes consultation or 15 minutes for trainees, it's clear no one can write that much, right? And so it's not quite genuine in that respect. And he says to me, I want you to think through things and learn that way. So sometimes it comes up with AI and reflective practice. We have to be really sure that AI doesn't give us unnecessary information. So the problem is AI needs to be ergonomic. It needs to give us the right amount of information, not too much information, right? So even when you reflect, if you were to put it in any AI, not just ChatGPT, any generative AI or large language model, they'll write so much information for you that it's just like, it's clear you never wrote it. And then it's like, would you actually read this? And why do we need more work? Why are we giving our trainers more work to read? Because then our trainers would just put that through AI and come up with a response. And then it's just like our AI systems are speaking to each other and we've lost the human touch, or we're speaking to each other. Now I'm very pro AI, but it needs to be more human based in it. And large language models, they are what they are. They're just language models. They just churn out from conversation what they expect you to say, and say in such an intricate way that sometimes if you read it, it doesn't really make sense. So I suppose we have to be careful with reflective practice, and yeah, just make sure we don't lose touch and make it more human-like. Yeah. Sorry.
That's a great point and distinction. I feel like, as we've learned in this collaboration too, we believe heavily in bringing structure to substance, and substance is not volume. Substance is when it happens in the moment of learning. I mean, you said something that happens upstream, you're having a conversation with a peer, or you just saw a patient case. If you can capture a snippet of that and make that a habit, and that captures that human element of what you're doing up front. I mean, really, there's tools that AI brings and other solutions that can automate that other, back half of that. But, as you talk to your peers, I would love to see or would love to hear from you on, how have your peers embraced this technology? What are you seeing? I mean, there's a lot of debate on, yep, students use this a lot, early grads will use this a lot. What about the full life cycle? I mean, you see patients, how do patients perceive it? So maybe there's a couple of questions for you. One, really, how do your peers see clinicians now or practice now in the light of AI, especially with reflective practice being a key part of work you have to do? Nobody really enjoys it, but if you really make it a fun habit, it could transform how you engage with AI and make sense of your world. And then the flip side of it is, as you're seeing patients, when you're seeing this feedback loop coming back from your care, your team and your practice. What are you sensing, from an AI standpoint, coming back as a feedback loop? Does that make sense?
Yeah. So my peers, so there's always going to be the ones that have been using AI from the beginning, right? They're the ones who are seasoned. I would say seasoned veterans, right? They're the ones who jump on everything and they will get used to it. Then there's the apprehensive ones that don't know. So there's always this fear that AI is kind of it's not their work, right? But really and truly, it is their work. It's just creating work from their work, right? It just generates work, so it's not plagiarism at all, right? So there's this, once they get to use it and they understand it, right? In some sense, they become better at it. But it's a skill in itself to learn how to use any AI tool in the best way possible. Like any technology, like we use System 1 in GP practices, right? It's actually excellent if you know how to use it. Yeah. And I suppose that capturing the snippet makes it easy just to talk on conversation and to bring out your voice. And it's quite difficult. Not all AI systems do that, to bring out your voice. And the feedback loop is, it's just you're more willing to record. So I would say this: you're more encouraged to record your learning points with AI, right? Because you can just speak to it and it'll record it for you. Okay. Then you are where if you were just to have to spend time and write it yourself. I mean, I'm only can speak from a GP, but there's a lot of admin work that we do generally anyway, right? We chase up referrals, chase up scans, see how a patient is doing, letters from hospital. But if you can capture that moment and you can go back and reflect back on that moment and save it, I think that's where AI will become unique. But in the UK, Niraj, I'm not sure, because in America, you guys probably embrace this a lot more. There's a lot of pushback from AI, a lot. And it's mainly, and in GPs, the seasoned clinicians, there's this pushback. But once they accept it, the doors open and they realize how useful it is. But then again, the NHS is like full of, there's too much change going on. And then people are just sick and tired of any change that's going on. There's like almost change fatigue, right? And they're like, and in their heads, they learned to do it the hard way. Why can't everyone else learn how to do it the hard way? But that's the general feeling I get from a lot of clinicians, especially the older.
Yeah, well, that's really at varying degrees, it's omnipresent. It's that sentiment with AI and how much it's taking over, and what is it really risking when you get past the exciting phase of it. You're facing that reality. We see that around, the different markets we operate in. We've seen that in the States. We've seen that even in UAE, Middle East, parts of Australia. I mean, there's a lot of uh, questioning of how much AI is good. And the scribing technologies are doing great. I mean, you can really capture and just riff whatever's on your mind and capture it through voice and make it really a talking, walking habit, to really make observations. For us, as we've looked at these solutions and what we've been building and what we're seeing from clinicians in coming back to our pilot and our collaboration, when clinicians actually did, GP trainees and GPs actually engaged with the platform and made it conversational, you start seeing that spark of, okay, they're capturing that little nugget. And it's been a big lesson for us as a company building for practitioners, is to know how much AI is enough, and at what point to surface it, and at what point to not surface it. And the other side of it is that we have, there's tremendous excitement around tools like Copilot and ChatGPT and Gemini, and there's an experimentative space where leaders and voices like you play with, and you can try it out, you know how it works, you understand the potential of it. We've been challenged with, or looking at, how do we take that excitement and box it into something that's a little bit smaller, easier to consume, and allows everybody in that spectrum of use to understand it, give it feedback, embrace it, use it, and actually make it a tool rather than a toolkit. It does one thing really well and it gets that right. And we believe that, that element of reflective practice, that example you said early up, how do I pick up these signals from my practice? What happens when I see a patient? I want to capture a quick nugget. And how RCGP has embraced the fact that you can use AI for doing that. I mean, cleaning up short form or expanding short form text into something broad and bigger is a great use case for generative AI, and it's a great way to build out your reflective portfolio or diary, CPD diary, and not have to worry about really typing words when you've really captured the gist of what you need. And that is something that's really exciting. What else have you been seeing in those?
Right,
Yeah.
it's a very good point there, because AI in this sense, some people are not very expressive like that,
Hmm.
right? And they don't know, for example, the case they've seen, how it does reflect the curriculum.
Hmm.
And with the reflective practice, what I've seen is they're able to connect the dots better,
Yeah.
right? Because they have met the curriculum, and it's given them that confidence to say that, you know what, I've actually seen these patients that show, for example, holistic care. I've seen somebody with mental health issues. I've seen somebody with complex morbidity, for example. How has, and it gets them to really think. And I really appreciate that, because is even for people that English is not their first language as well. I mean, they're very great scientists and they'll know everything. But and even for them, they found that it's a good way to express what they want to express, and reflect in an excellent way. And even those who English is their first language, they find they're able to say things in a way that shows they've learned, and
Hmm.
they know they've learned. And I think that's the key thing about generative AI, because it has helped a lot of people realize that they're learning and they're matching the curriculum as much as it's actually needed. Some people are just gifted and are excellent writers, right? And they might not, because not everyone will find this of benefit, right? It's just life, right? But
Yeah.
the majority of people, that capturing the moment, and what I've realized is, once they start using it, and the one feedback was this, right? I didn't share this feedback with you, Niraj, last time, but during the pilot, one person actually said to me, because it's not the reflective piece asks you specifically about what have you learned, right? It's more tailored to the case, and then it doesn't give you 4 or 5 lines, right? Like ChatGPT was, that just seems like, yeah, you copied and pasted this off somewhere else. It'll just give you like two lines, like a sentence or two, that's enough for the reflection. And then you don't overwhelm, because no one wants to read. Because this thing about medicine as well is the more senior you get, the less you write. Yeah, yeah, yeah. It's true. It's true because you need to just get the specific points there. We spend our whole day just reading letters, reading consultation notes, following on other people's stuff. You don't need more information that you don't need to know. The context is quite clear. You don't need to make it that point. And I think that was a good point in that sense. It's just capturing it there. What you've learned, it could be one sentence, shown in a way that you've reflected you've reflected on the curriculum, and that's how it should be.
That's amazing. Yeah, I think that's been a big anchoring point for us too. So we're gonna get a little closer to some Q&A here to hopefully start getting to a point where we can put this question back to our listeners. But before we do that, I do want to ask you, what's the one thing you're not excited about with this? What has AI introduced that you are not a fan of? You see, and before you answer, just for the audience and the listeners, we've collaborated with a lot of clinicians as we've built this platform. My co-founder and the team, we've always said this is built for the clinicians. I mean, we've seen a lot of reflective activity in the platform, more than 1 million credits in some form or another around the world. And there's a common theme that clinicians bring to the table around this inclination and this desire to show that they're learning. But then there's been some experiments that we've done with AI that haven't gone as well. And that's just the nature of being a product-driven company, but also just learning, clinicians are unique and healthcare is unique. As much as you want to stuff it with all this potential of exciting tech and AI, where do you really see the stopping line? And there's the big AI labs that are building all these innovations. And then there's these, boutique niche providers that are getting it right. And we like to fall in that second bucket. But from your perspective, what is about AI that has made you go like, I just wish this wasn't here right now? Can we just not do this right now?
Well, it's two things really.
Yeah.
Maybe it's a kind of thing that you teach yourself that it's gonna make life easy, right? But then life is not supposed to be easy. All right. And then then it churns out something, and then when you read it, you'll be like, oh damn, that's not what I meant. All right. And then you still have to read through it. And the problem is you think you'll get it right and the writing will get it right. But you're responsible for whatever's written because you click OK and you copy and paste and you put it there. Right? Because that's the thing about getting AI accepted is that clinicians need to accept that whatever they put is their responsibility, right? That's the only way AI will ever work, right? Otherwise, they're going to say risk and not risk, and it's going to be cycles, right? But I think it probably is the thing that you trick yourself thinking is going to be this magic that's going to solve all the world problems, when really it still needs human input and for you to read through it and be like, that's not what I actually meant. Okay, let me delete this. Let me just change this a bit to how I do it. And I think it's better that way anyway. I think it's better that you can make changes to make it sound a bit more like you, because it'll take time for any AI system to be unique to you. Any AI system should have the ability to you to tailor it a bit more to how you sound. I believe that as well. Second thing with AI, actually, is conversation with my supervisor yesterday, actually. And he was saying, there's like this risk stratification, for example, predicting worsening outcomes for people, and you get these AI models that just take all this data and they cluster data and they just look for patterns, right? And then he said to me, the problem is it's going to build more work for us. Yeah, it's going to build more work, and then everyone's afraid that this, because GP is always dumping ground, right? So then everyone's afraid that all this preventative work and all this prevention work, we're going to realize there's so many more people that need help, but they're not putting money into actually creating services for this. So it's going to give us all this new information, right, that will save money and health in the long run. But in the short term run, you need to act on that information. And also then it's AI. The fear is it's not going to be ergonomic.
Right.
That is the fear. The fear is, something else I have to learn new.
Yeah.
it showed us that, and I think that is the big thing about AI is just like you're dealing with people. Niraj, I give you your patience because you're dealing with people that are just burnt out, right?
Yeah.
Are just burnt
Yeah.
out, overworked. I mean, everyone's burnt out. I mean, like across the NHS, everyone just worked out, and even people in the private sector as well. Like healthcare across the world is just burnt out. Like,
Yeah. Yeah.
and everyone just doesn't need that extra work just to pile on top, and that's the sensation you get. But once you break that barrier, AI helps with that. But also there's that fear, which is I think is a quite founded fear. Like,
Yeah. Yeah. Ergonomics, like that's a magic word with AI. There's so much cool happening, the pace at which those technologies are evolving, and those companies are kicking out some amazing product. There is a real check on, hey, is this actually easy to use? I mean, it will be if you learn, but that part, if and when you learn, means there's a time commitment. You have to be in the right mindset. It can't just happen. Like, you can't just like wake up one day and get a tutorial and be great at it because it's such an experienced product. It's not something that you just turn on. It's not like a calculator. It actually has to be a little bit more of trial and error and try it out. And that's really been an exciting part of, working with your team for us. And, the one big lesson on our side has been, we're technologists. We've been building AI solutions in the learning space for a long time. Like I said, more than 1 million credits in some form or another given around the world. None of those would be possible without working with clinicians and understanding really how clinicians reflect, how they use technology, when they use technology. I mean, our one of the widest used features on our side, um, you know, couple of them, but one of them is a notebook. I mean, it really is just a notepad that is intelligent to capture, what reflective insights are. I mean, it really is bringing structure to substance. And it's like, how do you really make it better than that? And sometimes you can't. You just bring it to them in contexts and moments where they are, clinicians are, our users are, and make them realize that, listen, I'm going to give you a lot of AI and you're going to have access to a lot of it. Anybody can get a chat GPT subscription anytime, whatever you want to do. It's not about taking one line and making 50 out of it. It's just making that one line yours and seeing how that one line is giving you a voice, giving you your DNA and your expressiveness. And like you said, not everybody's a writer, not everybody can write eloquently, but everybody learns eloquently. They just can't express it. And there's a way for this tool to be an equalizer and almost like a way to really bring that value in. So I really appreciate this conversation. I feel like I can talk to you for a whole day, and I do sometimes, you know it. And it's a lot of work that we do together, and this collaboration has been a special gift to us. We really appreciate, Kieran, this opportunity to share the story and narrative with the greater group here. We at Learner Plus work with clinicians and for clinicians, and we're built and are doing some exciting things for clinicians, building reflective guides, bringing Learner Plus into Chat GPT pretty soon. So if you're using and learning in Chat GPT, you can reflect right there. A lot of beautiful things that we're going to be talking more about. And of course, we'd love to share a greater story of our collaboration with the NHS, specifically with Osama and the greater group. But very appreciative of this. I'm happy to take questions. And if there's anything else, Doc, you want to share, please pile on. But I think this has been great enough to see where we take this.
Thank you very much, Niraj and Osama. So that's a fantastic start. Let's open it up to the audience. If you want to go to the chat box and you can enter your questions there. And while we're warming things up, why don't I kick things off with a first question and break the ice? Osama, I'll ask you this one. Reflections, often they need to be confidential. How do we tackle the need for reflections to be confidential and also using AI? Over to you.
so that's actually a question Niraj actually asked me when we first done this pilot, and people were asking that. So regardless, anyway, our portfolios, if you put anybody's name, even if you use the word Alzheimer's, I think it reflects. You're like, oh, I think the technology in our portfolio would say, I think you've put some identifiable data. So generally, and most AI tools don't store things, even if you accidentally put you wouldn't put someone's name, you put the scenario. right? When you reflect, you put the scenario, put the age, and you put like the demographics. So it wouldn't be someone that the AI can identify generally. And there's always the risk that you might copy and paste a letter on there or something like that, which most people wouldn't do because they'll just do the body, right? And in terms of confidentiality, so that's quite a key thing. It's a key thing. I'm not sure if, for example, in ChatGPT, that your chats can be accessed by somebody else. I don't know, Niraj, if they can, right? And a lot of things, whether they're stored locally or not, or they're stored on a national server. But most times is the short answer is our even portfolio doesn't allow you to put identifiable data on it. So even when you reflect, you have to delete that. And I think clinicians just need to be a bit more responsible. And I think clinicians are responsible in that sense about sharing data, because you don't need patient's name, date of birth, anything like that. The age, demographics, and not even demographics that much. Just the age and sex, and that's it really.
Yeah, it's absolutely right. No, there's tools that do that, sometimes, and part of why you want to use tools that are designed for specifically these scenarios, because they will scrub out, we scrub out anything that is health, private information, personal information, drug names, brand names, we wipe them out. And part of that is just best practice because it's really helping them think about that. But Kieran, it's a growing concern. It's also, if I'm a clinician and I'm reflecting or capturing all these insights in some tool, what's in it for me? What are you going to do with that data? That, data becoming an asset is just everywhere now. So it's a big challenge, but also an opportunity.
Thank you. Please do add questions to the chat box as and when to our audience, but I'm going to ask another follow-up question. I'll start with you again, Dr. Soar. When we spoke about confidentiality, you were kind of talking about patient confidentiality. What about me as the learner? So I'm kind of where I might not know much about asthma, but do I want to tell the AI that I don't know much about asthma, that it's a learning need? Dr. Sewer, over to you.
Oh, you'd be surprised. People tell AI all sorts of things. I, I think I think there were people that were building AI tools for mental health, and they said, and had CBT tools in there. And some of this research that came out from it was that people are more comfortable talking to a third person or AI that can respond to them. Um, I actually think, yeah, people that, if you want to learn, for example, and you want to reflect on your asthma situation, sometimes AI can break down things to you in a way that you would understand, right? I mean, people use ChatGPT. I use ChatGPT for learning all the time. I use when I want to reflect more on the Learner Plus platform, the Learner Plus will ask me. I'll ask the actual platform itself, and I'll say, what curriculum what in the curriculum do you suggest that I've reflected in this case? I might have not reflected something. And I think it's about being honest, because I think the clinician that acts like they know everything is a dangerous clinician. I remember my supervisor told me that. The best clinician is the one that's honest, and just honest about what they know and what they don't know. Anyone who acts more like they do or don't know. And I think about confidentiality, I think clinicians are okay to say they don't know, because if you get it wrong, the consequences are huge in our field, right? But confidentiality in myself, I think, from my experience, clinicians are quite happy to say they want to understand more, or I'm not sure about the guidelines. I mean, even my supervisors ask me about certain things. They might have not up. The last time they updated the guidelines was quite some time ago. Something new came out. For example, Monjaro, anything like that, because there's all new things coming out every day. So yeah, I think they'll be more comfortable asking the AI. Yeah, definitely.
Okay, thank you. Once again, I'll say to our audience, please do add questions to the chat. But I've got another question while we're waiting, and I'm going to pick on you now, Niraj. Osama, you can relax for a second. Niraj, one of the concerns about AI is the environmental effects and the energy consumed. And of course, we want to, as a result, only use AI when it's needed or use environmentally friendly forms of AI. Niraj, over to you.
Yeah, I think it's a bigger area of work in that space that has informed us and our work too. But I mean, it's kind of like using a car to drive from your house to the park across the street. You can do it. Do you want to, or should you? Um, Not all AIs are equal. And while all AIs have been developed with the same mindset and approach and technology, some use more energy than the others, and partly because they've been designed for generalist use and broad use. They want to be the one tool that is the one companion you have, your one AI assistant you have that does everything from researching restaurants to telling you if you know enough about asthma or not. Now, is it doing a great job or not? That's up for you to decide. But those tools that do everything do consume a lot more energy than tools that are designed to do one thing. And that's where having specialized tools or AI tools for specialized needs make a lot more sense. That's where there's opportunity in the AI landscape to really innovate and build solutions that are hyper focused. They're more efficient, they're better for the planet. They're also easier to make sure they don't hallucinate or go out of context and start making up things because they know too much but don't know too but know too little of how those things connect. And that's where, computing power, energy usage, efficiency, good design, model size, all these things about technology make it all that AI, not all AIs are equal, and it's a good thing. And pick the one that fits your need, validate the need, and then make sure that it's the right size, the right scale. Not everything needs a chat GPT.
Thank you. Thank you very much, both. I'm just checking if there's any more questions. There aren't any more at the moment, but we'll give people one last chance. I'll ask one final question, and either of you can take this one. I guess it's about AI being based on data, and the problem often being the data is biased, wrong, missing, often biased, or not representative, or not diverse. And that might be driving reflections in a certain way, perhaps. Is that the case? And if it is the case, what can we do to overcome that? Sorry, it's the last question. It's not particularly easy one, I'm afraid.
I'll kick this off from a tech/AI seminar. I'd love to hear um, Doc's views too, just from a standpoint of how they're looking at bias and reflections and from the other side of it. But it really comes down to design. And yes, AI does what AI gets. AI spits out what AI is trained on. And if you're really building an AI that answers factual questions, there's a lot of risk around bias that shows up because what facts are sitting in there and how are they going to be represented. Um, when you design an AI to just go only as far as to help you think or question your thinking, then you have a data set that you're looking at that isn't as biased or leaning towards one perspective or the other, and you get into some first principle data that helps you build technology that's grounded on first principles, where you're asking questions around thought process thinking, system one thinking, system two thinking, understanding what is it that leads to cause and effect, thinking about mental models. And a lot of these tools, these cognitive tools, are designed from behavioral psychology, behavioral economics, andragogy, pedagogy, learning principles. And the reflective nature of AI at that point is to build those into the technologies versus actual answers from people or volumes and volumes of data of what people have said is a good reflection or not, or bad reflection or not. So it really comes down to that aspect where you kind of want to be mindful of, what your AI is trained on, but because you get to pick what task that AI does, you get to be the decider of whether that data is biased or not too, and actually make a decision whether that AI should be built or not, because you might not have a full set of fairly weighted, unbiased data for that scenario. So that's kind of, as a technologist, that's how we've approached this. I'd love to hear more from Dr. Osama, on this one?
I'm just going to ask you, Niraj.
Great.
So from what I understand, and the problem is, I'm going to overload the audience because it's going to become too technical, right? Yeah, but so the difference is ChatGPT is open source, so we can get information from TikTok and then from encyclopedia from something, right? That's the difference, yeah. That's why you get hallucinations, and that's why you get that, right? I'm just thinking through the process now. When you come to reflective practice, right? So it's more closed, right? But is it? Then the question becomes then examples, because obviously our portfolios, the Royal College of GPs, they've got examples of what good reflection is, right?
Right.
And obviously that might have its own bias, but that's a bias
Mhm.
that exists in society. That AI is not going to be it's not going to be a magic tool that's going to get rid of that, right?
Right.
The question comes. I'll put the question back to you. How do you train the data about what is a good reflection, what isn't a good reflection? Against yeah, and because it's quite difficult to talk about biases in reflection, because even in reflections, they're kind of a bit. No one's going to reflect. People will reflect on big cases, right? But
Yeah.
no one really reflects on a case that makes them look bad. Yeah, because
Right.
you're just giving ammunition on people to scrutinize you. I mean,
Yeah.
there are cases that the Bawagaba cases, they attacked her reflection,
Yeah.
for example, right? So no one's
Yeah.
going to really. People are actually very wary of what they put. So it's quite difficult because they wouldn't put too much controversial cases in their reflection because no one wants to show how anything bad, right? But how do you make sure the data you train is not biased?
That's I'm gonna try to avoid answering this by getting into a space that is way beyond this call. But the way to really think about that is, there's two ways of approaching AI, and one is a yes/no system that understands correct, incorrect, or some scale of correct, incorrect. There's a lot of risk of bias when you are asking something that needs to be validated as great or not great, um, correct or incorrect. This is a good reflection, this is a bad reflection. These are one way of looking at the technology. The other way to look at it is, what is the person that's leaving the reflection signaling? Can we sketch a signal on, are they signaling some learning? Now that gets interesting because now you're not really saying that's a good reflection or a bad reflection. Now we're starting to look at change and velocity and how people are thinking. Is there some improvement? Are they questioning something? Are they challenging something they knew? These are first principle signs of somebody learning. I don't agree with this guideline. Why? Because of this. Okay, you've attached some reasoning for it, and feedback of that loop goes right into your system. Now you've built an AI that's understanding direction of learning versus validating your actual learning. And that's the point of reflection. Is we've always said it in our system, in our world. Yeah, when you reflect on something, you're not agreeing with it necessarily. You're not agreeing with a concept or an observation. You're really making an assessment of what has that taught you, if it has anything, including you learning that this kind of case never teaches me anything. That is a reflection in itself. So if I got to stop seeing these kind of patients and trying to think about what else, what other treatment works, because guess what? This method that I use works great. I do not need to change anything about this. That's a great reflection. But if you give that to a scoring engine, that scores pretty low because it's scored on, well, you didn't really do something different, so that must be a bad reflection. So a longer question is like how you change and how you train the AI. It depends a little bit on the data that's been provided, a lot on the data that's been provided, a lot also on how you perceive the value of that data. And what is it that you understand as signaling good reflection versus actually good reflection? And what do you want to score? And we take pride in signaling change versus actually saying, yeah, you're right, and you get 5 points for it. I don't think AI can do that and shouldn't do that. You're muddying the waters.
Thank you. Agree. Thank you.
Okay, Thank you very much, both. We don't actually have any more questions, but I think we've had a really good and interesting discussion. We've had quite a bit of feedback as well, positive feedback as well, which is really good news. So that's the end of the kind of the core content in today's webinar. Once again, thank you very much to Learner Plus and to our two speakers for their excellent presentation and great discussion. On behalf of BMJ Future Health, we're excited to announce that registration for the face-to-face event on 6th, 7th November is now open and the program is live. You can scan the QR code on the screen and visit our website for further information. Call for Problems is also now live, so you can head to our website and submit your problem up until the 31st of July. Our next webinars will be Friday, 27th of June, midday, on realizing the potential of virtual care, how to use digital technology to bridge gaps in care for hard-to-reach patients. And then on Friday, the 25th of July at midday, bridging the digital literacy gap, equipping clinicians with the future skills they need. So finally, thank you very much again for everybody for participating. We hope you found it valuable. Thank you.